Hi, I'm Eric. I'm an ordinary guy living an extraordinary life with a wonderful family, wonderful children, wonderful wife, and I have IgAN. I feel most alive when I am spending time with my family, traveling. In Georgia, we have a lot of summer pool days and then barbecue afterwards. What got me into barbecuing was, first I started watching a lot of cooking shows. And I think somewhere along the way, I watched one that focused on barbecue a lot. I have won a few awards. I've had competed in quite a few competitions. I have won 3 or 4 times in the ribs category. When I was 30, I was at that point still a pack-a-day smoker. And I had noticed that I could hear my heartbeat in my ear. So that just kind of intuitively, I assumed that's not a good thing. Made me go ahead and go talk to a doctor and have him take a look at it. They figured out while I was in the hospital that I had some kind of kidney problem, some form of renal problem. And they contacted my primary care doctor, and then he put me in touch with my nephrologist. When I first heard that I had IgAN, I didn't obviously know what it was. The web was not what the web is now. The web then was you search around and try to find things, and you find some monographs, some studies and such. Because in the case of IgAN, you don't know if it's going to be progressive, if it's going to go into remission, or something in between. To manage my IgAN, it was initially just blood pressure medication and keep an eye on my kidney function. I had been in remission from IgAN up until about 2021. My PCP at the time was the first one to notice that my numbers were going in a bad direction again. Then, he said, let's go talk to your nephrologist and, see what he wants to do. And my nephrologist and I talked, and he had a couple of treatment options and started working to add in more to get that proteinuria to come back down. But we weren't really getting all the way back to where we wanted to be. There was improvement, but it was, I was still up in a range. My nephrologist assumed there was kidney damage going on, but once we had determined that a prior treatment for IgAN wasn't working, he told me about FILSPARI, asked me to go do what I do, which is search around on the web. When my doctor suggested FILSPARI, I asked, what are the side effects? What is the cost? What is the efficacy? How does the drug seem to work for other people? During researching FILSPARI, I found that it was a treatment option that seemed to have very good effect on proteinuria for many patients. That wasn't a steroid. And those were kind of 2 of my biggest, goals or, check boxes for treatment. My doctor and I decided that FILSPARI was right for me. So while I was anxious about starting new medication, I was optimistic about potential for further improvement of my proteinuria and my GFR and my proteinuria. I got, as close to normal as I could get. Everything I've seen, my personal experience with FILSPARI has been that it has improved my proteinuria, my kidney function, my GFR. Total care team has been really great. My nurse is Cindy. She's been my nurse the whole time. She answers any questions I have. She provides information about, how things are going with my insurance or and works with the labs and so forth. And then, it's nice to have someone to work with who also is, working with the pharmacy, working with, the doctor, and so forth and so on. I would tell somebody who was considering hesitating or taking a wait-and-see attitude toward IgAN that they should go and do what their doctor says. Seek out treatment. Take your doctor's advice. Preserve that kidney function.
What is FILSPARI, sparsentan? FILSPARI is a prescription medicine used to slow kidney function decline in adults with a kidney disease called primary IgA nephropathy, IgAN, who are at risk for their disease getting worse. It is not known if FILSPARI is safe and effective in children with IgAN. Important safety information. What is the most important information I should know about FILSPARI? FILSPARI can cause serious side effects including liver problems and birth defects. FILSPARI can cause changes in liver tests. Liver failure was not observed in people treated with FILSPARI in clinical studies, but some medicines that are like FILSPARI have caused liver failure. Your healthcare provider will do blood tests to check your liver before starting FILSPARI, and then every 3 months during treatment. Your healthcare provider may temporarily stop or permanently stop treatment with FILSPARI if you have changes in your liver tests. Stop taking FILSPARI and get medical help right away if you develop any of the following signs of liver problems during treatment with FILSPARI: nausea or vomiting, pain on the upper right side of your stomach area, tiredness, loss of appetite, yellowing of the skin or the whites of your eyes, jaundice, dark tea-colored urine, fever, or itching. Because of the risk for liver problems, FILSPARI is only available through a restricted access program called the FILSPARI Risk Evaluation and Mitigation Strategy, REMS. Before you begin treatment with FILSPARI, your healthcare prescriber will explain the FILSPARI REMS. You must read and agree to all the requirements of the FILSPARI REMS. FILSPARI can cause serious birth defects if taken during pregnancy. Patients should not be pregnant when they start taking FILSPARI, become pregnant during treatment, or for 2 weeks after stopping treatment. Patients who can become pregnant should have a negative pregnancy test before starting FILSPARI. Patients who can become pregnant should use effective birth control before starting treatment with FILSPARI, during treatment with FILSPARI, and for 2 weeks after stopping FILSPARI because the medicine may still be in your body. Talk with your healthcare provider or gynecologist, a healthcare provider who specializes in reproduction, to find out about options for effective forms of birth control that you may use to prevent pregnancy during treatment with FILSPARI. If you decide that you want to change the form of birth control that you use, talk with your healthcare provider or gynecologist to be sure that you choose another effective form of birth control. Do not have unprotected sex. Talk to your healthcare provider or pharmacist right away if you have unprotected sex or if you think your birth control has failed. Your healthcare provider may talk with you about using emergency birth control. Tell your healthcare provider right away if you miss a menstrual period or think you may be pregnant. Who should not take FILSPARI? Do not take FILSPARI if you are pregnant, plan to become pregnant, or become pregnant during treatment with FILSPARI. FILSPARI may cause serious birth defects. Are taking an angiotensin receptor blocker, endothelin receptor antagonist, or aliskiren. Ask your healthcare provider or pharmacist if you are not sure if you take any of these medicines. Before taking FILSPARI, tell your healthcare provider about all of your medical conditions, including if you have liver problems, are pregnant or plan to become pregnant during FILSPARI treatment, or are breastfeeding or plan to breastfeed, as it is not known if FILSPARI passes into your breast milk. Do not breastfeed during FILSPARI treatment. Talk to your healthcare provider about the best way to feed your baby during FILSPARI treatment. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and grapefruit. FILSPARI and other medicines may affect each other and cause side effects. Do not start any new medicine until you check with your healthcare provider. Especially tell your healthcare provider if you take non-steroidal anti-inflammatory drugs, NSAIDs, potassium-containing medicines, potassium supplements, or salt substitutes containing potassium, blood pressure medicines. Ask your healthcare provider or pharmacist if you are not sure if you take one of these medicines. What are the possible side effects of FILSPARI? FILSPARI can cause serious side effects including liver problems. C. What is the most important information I should know about FILSPARI? Serious birth defects. C. What is the most important information I should know about FILSPARI? Low blood pressure. This is common during treatment with FILSPARI and can also be serious. Tell your healthcare provider if you feel dizzy, lightheaded, or faint. Stay hydrated during treatment with FILSPARI. Worsening of kidney function. This is common during treatment with FILSPARI and can also be serious. Your healthcare provider will check your kidney function during treatment with FILSPARI. Increased potassium in your blood. This is common during treatment with FILSPARI and can also be serious. Your healthcare provider will check your potassium blood level during treatment with FILSPARI. Fluid retention. FILSPARI can cause your body to hold too much water. Tell your healthcare provider right away if you have any unusual weight gain or swelling of your ankles or legs. The most common side effects of FILSPARI also include swelling of the hands, legs, ankles, and feet, peripheral edema, dizziness, and low red blood cells, anemia. Your healthcare provider may change your dose, temporarily stop or permanently stop FILSPARI treatment if you develop side effects. These are not all the possible side effects of FILSPARI. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Travere Therapeutics at 1-877-659-5518. For additional important safety information, including serious side effects, please see the medication guide.